So we need to move on because we're running a bit late. I understand Nick Ross is not here, but Sheila Mitchell is here. So lovely to see you, Sheila. Thank you very much for making the time, and look forward to hearing your thoughts about how do we tackle the health and healthcare inequalities in London.
Thank you. Shall I just start 2 minutes on my background just to narrow the sphere that I can talk about? So my own career background is I'm a commercial sector marketeer who saw the light 10 years ago, and I've been working in health and in the public sector, looking at how do you bring the hard-nosed commercial practices into some of the big, tough problems that face health in particular. So I guess two big thoughts that for the Commission to consider, and it is more about how does London as a whole think about, strategise and organise marketing, and if we can define what I think marketing can and cannot do, and then how do you optimise working with digital and digital technologies going forward in the context of behaviour change. So just to define what marketing is, it's not the people who run the nice television advertising campaigns. I think we've moved into a much more sophisticated place where marketing is about getting deep insight into how and why people do as they do, and how can you configure programs and interventions, and increasingly digital interventions, to help people actually change their behaviour. So by doing that, the remit that I've got at the present moment is for the national programme. So we have a national budget, and the brief is how can we create cut-through programmes that can then be amplified at a local level. And one of the questions is how does London maximise amplifying some of the national activity? So I think a key issue and a key deliverable for London is it's fantastically good at mapping what are the health issues, what are the health priorities, but do we have a really effective overlay that says this is how people live their lives today? So this is where people shop, these are the affinity groups that they have, this is the programmes that people want, this is who they listen to, this is their role models. I may live in Tower Hamlets, but actually I spend 90% of my time in Covent Garden because. So how can you map people's lifestyles and how that therefore impacts in terms of how do you engage with them, recognising the limitations that marketing has about communications and engagement, that it can't do everything, and some of the groups that Camilla was describing, this is not a place that marketing can actually add any value. So there's a piece in terms of how do you map London and how do you therefore map the priorities against it, and I think that then starts to give you very clear directions about how do you actually structure and organise a marketing function. So there will be times when, if you live in London, you are as motivated by a national initiative as by a local initiative. We created Stoptober, which was a hugely big participative national event which took a very negative subject and turned it into a positive. Let's all quit in October. So that's a national programme. Equally, there are areas which should be treated from a pan-government perspective. So you have pan-government London media. How are you optimising the use of those to actually get London to do something as a collective? How do you then start to move to what is truly place-based and local? And then the next level down is, especially with digital technology, how do you start to get really individual one-to-one messages? And I think moving into the impact on digital, mobile has got to be a key factor in terms of how everybody, even in terms of health inequalities and various socio-demographics, everyone has got a mobile, 90-odd% penetration of smartphones in 3 or 4 years' time. How can we work together where public health has the clinical expertise, it's got the behaviour change thinking, it's got the content. What it hasn't got is the big channels and the big platforms to get out directly to people. So one of my key recommendations is there has to be a way of looking at how are we truly going to embrace digital innovation from an organisational perspective, and has London got the appetite to say we will have strategic partnerships with technology companies to specifically drive major behaviour change initiatives.
And thank you, that's fantastic. How do we compare with other countries and cities in relation to our marketing whatever we're doing in marketing at the moment. How do we compare with the Americans?
New York is the one that always springs out. I mean,
Sure.
we tend still to look at comparative global marketing on an issue-by-issue basis, which probably isn't the right way to do it, rather than taking a whole city approach. I mean, New York is the area that has done most, but it's using marketing as one of the policy levers. So there are certain things that marketing can do on its own, but there are other areas where if there is regulation or taxation or legislation, marketing helps create the culture and the environment.
But London did fantastically well. Do you remember the marketing they did around stroke care and around chest pain? Did you see do you remember the posters with the tightness going, or the belt going around the chest about 4 years ago, something like that? Less than that, yeah. I mean, within the country, within NHS England, you work in NHS England.
No,
Public Health England. How would I ever get that wrong? So how does London compare with the rest of the country?
I haven't honestly got that comparative data.
Yeah.
I can certainly look at it from the national campaigns, and I can say where is London more responsive than others. So I can look at it in terms of response data. But I guess that's a really good example. So London ran a really good stroke awareness campaign, but equally at the same time there are national stroke awareness campaigns.
Sure.
So there was FAST, which was FACE, whatever it was. So how do we really know which one it is that's working? So it's back to my point, is don't do something pan-London. If there is a universal insight and an effective mechanism for doing it at national level, do something in London that is truly about the London market, or explode and amplify what's actually going on at a national level and bespoke it into London.
Yeah. I mean, Boris is a unique entity in many ways, and you can't get away from that asset as a marketing tool.
Yeah.
And that's why, whatever you say, you're correct. But, we need something on the London side. I mean, take the Boris bikes as a good example.
Yes. And that's
it's
fantastic.
succeeded because it has the brand.
It has, and that's where I think you need to look at what is truly pan-London, where there is an esprit de corps or a Londonness that people will buy into.
Yeah.
So, Stoptober is just, I keep coming back to Stoptober, that was a national initiative and a national brand. It didn't need to be Stoptober for London, but there are certain things where you have a city that can campaign on certain issue. And I guess I look at the powerfulness of the Evening Standard as your pan-London medium, where they campaign incredibly effectively and well. So how does London here orchestrate itself so that it can leverage those kind of agendas and those kind of media?
Fantastic. Please, Kaz.
Sheila, it's very interesting. I think it's a really fascinating area. I wanted to just ask you, we would like to focus on trying to capture from patients the outcomes that are important to them as drivers both of service redesigns and particularly as drivers of integrated care, because they do act as drivers of integrated care. Having captured those outcomes and used them as our system measures, how would you, in terms of social marketing, how can we provide patients with the information around things like outcomes? How can we persuade them to use those as you publish them to actually make real choices, and then to start actually addressing some of the most difficult issues across our healthcare system, which are around reconfigurations, understanding actually from those outcomes where some providers are achieving and others are not, because it's very difficult, I think, for patients both to understand the material that's provided to them, but also then to use that effectively to improve quality of services.
This is in the context of service reconfiguration and
service redesign.
Service redesign.
Allowing patients to actually drive that through quality improvements driven by outcomes.
And I think it's almost like the process that we apply to any communication problem, which we start with what is it that people are saying to us and what are the deep insights to what people are actually saying. So obviously we've been through a process where we've listened to people, so we need to play back to them. We've listened and you said that this is what you wanted, and you then have to go through the next process, which says what are the optimum touch points where you can actually communicate and that people will be prepared to hear what it is that you've actually got to say. Sometimes it's national campaigns, sometimes it's information within GP surgeries, sometimes it's at the point of contact with the GP or within the hospital. So you have to map out where are the different points where people are in a mindset that they can hear what you're actually saying to them. And then there's a sort of bread and butter piece of work that you've got to do, that any communication has got to be really clear and in different formats and tested with people as well to say, do you actually understand what this is asking me to do? And then the next key point is you go back and you measure and evaluate and say, have they done what we thought we were asking them to do?
Thank you. Anyone else wants to on the health and well-being?
I was just asking about the one-to-one messaging, the extent to which, if you understand a person, because I don't consider myself to be a patient, how could we use one-to-one messaging to affect how I look after myself, for example?
I think this is the tipping point for digital actually now. So if it's, I guess the area that I'm coming from is one-to-one messaging in the context of prevention. So how can we have relationships with people which are relatively low cost because they're existing in digital space? And you know, there are people out there who just do this fantastically well. Amazon does it fantastically well. Some of the banks do it fantastically well. The airlines do it incredibly well. So it's how do you effectively capture people's data? And there's a lot of work goes on at a national level, certainly on NHS Choices and NHS.uk, which is looking at how do you create big data in terms of areas where people have raised their hand and said, yes, I am interested in being healthier, and given you permission to get in touch with them. Now, the minute you've got that, that's like the silver bullet, because you've got a way of engaging with them and having an ongoing dialogue in digital space. And increasingly through, you can offer them tools, you can offer them apps. We've got a great app that we've developed called Couch to 5K. We have a database of over 1 million people who have asked us for help to quit smoking. You can then go back to them in X months' time and say, did you manage to quit? Now, you may find out that you're putting on a bit more weight, so actually here's some tools to help you manage your diet or your lifestyle. So I think it's that investment in data and digital marketing and digital databases. I think that's what London needs to look at. How is it going to organise itself to deliver that kind of functionality?
Thank you. Any other questions? Could I ask you one final question? Sorry.
Go ahead.
Go ahead, Yvonne. Come on.
Just a very quick one, Sheila, is about the segment. We're thinking of segmenting the market. This is something we haven't done well in London either, is understand the various strands of people and places. So how far could we take that? I mean, you made a statement that you wouldn't really think marketing had anything to offer Camilla's provenance. Now, how far could we take a segmentation down? Because if they've got access to mobiles, then surely we could begin to talk en masse to people without necessarily getting permission, but sort of get messages to them.
You've got to get people's permission to be able to have a digital dialogue with them. That's a sort of data transparency issue. But I think you're basically saying how can you fully segment? And it's very difficult to do because if you talk, there was a major piece of work done called Healthy Foundation Segmentation, which looked at a variety of parameters around people's attitudes and around self-efficacy, and it just became impossible to target. So looking at it from a marketing perspective, I could not buy ways of reaching these people based on these different parameters. And time again, we come back to its age and its socio-demographic status, which are the big drivers. But where you do need to get more sophisticated to this piece of work is where are people's frames of reference and where are the communities in the broadest sense that they belong to. Especially, we looked at 11, 12, 13-year-old girls. How do you get them? Well, you get them through the schools, but actually there are 2 big digital sites where all little girls go to. One of them is called Dolan, and we go into these virtual worlds and we asked them if they wanted information about smoking, and over 40,000 little girls asked us questions about smoking. So I think I've travelled a long way, but it's basically to say that segmentation has to take into account how do you actually reach and engage in very different ways beyond place.
Yeah, thank you.
So how long have you been in public health England?
Since April, since public health. I was at the Department of Health for 5 years before that.
So you know the system and how it works. Could you just answer me the question? I went out to get my lunch. I get my own lunch because for all sorts of reasons, including the calorie intake. So how come we are not piggybacking on many new food industries and other industries who do health and well-being? Why don't we ring their doors and say, could the NHS work with you, or even ask them? I mean, there's a huge amount. I mean, that's the American model, as you know. You know, it's all in partnership with the private sector. It is in partnership with football clubs, it's in partnership with
The private sector.
the private sector. Why we have this thing that we don't want to get the NHS to? It's just branding thing, you know.
Well, it's good, but it's a point I haven't made, which is, as you look at using marketing, what is the brand that talks to people and talks to them? So when we talk to people about healthy lifestyles, we talk to them through the Change for Life brand. And when we're going to talk to young people, we'll talk to them through an unbranded, or what we call white-labelled movement. But if I go back to healthy lifestyles and going out to get your lunch, we absolutely work in partnership, because when we created the movement called Change for Life, which was to address the Foresight report and the obesity issue, the problems are so complex and so difficult that we agreed with the policy teams and with the ministers, you absolutely have to work in partnership with the commercial sector in this one. However, it has to be under very clear terms of engagement. So if we are going to work with large supermarkets, as we do with Asda and with Lidl and with Tesco and with Sainsbury's, and we create a campaign push at the present moment, the push is around smart swaps and swapping from fizzy drinks to low sugar drinks. We will use taxpayers' money to get the message across, but that it is amplified across a multiplicity of different partnerships in stores. Even people like Pepsi Cola are incentivising low-calorie drinks at the present moment. So we'll work with product manufacturers, with retailers, and with the commercial sector, as well in the commercial sector, but as well as with voluntary sector partners. So partnership is absolutely at the heart of the national programmes, that we will spend X, but we would look for that to be leveraged and amplified by a Y percentage through all these different partnerships.
Yeah. Okay. That's great. Any other questions? Thank you very much for your time, and look forward to your help in our marketing exercise. And the Mayor is extremely keen on this.
Good.
And I think we could do better than we're doing at the moment. So we need some fresh new ideas.
Okay.
And it'll be fantastic to get those. Thank you.
Thank you.
Thanks.